Hello, my name is Dr. Stanley Lang, and I'm a family doctor that is interested primarily in promoting whole person health. And this is a continuation of the series that I've been doing on health of body, mind, and spirit. And today I'm focusing on a physical health issue that overlaps a lot into the emotional and spiritual areas. So the model that I like to use is this triangle that shows the interconnectedness between spiritual, physical, and emotional health. And the question that I'm uh, briefly focusing on today is how to deal with addiction and what do you do to try to improve your ability to deal with the withdrawal from addiction. So the the reason I'm focusing on this today is I saw a patient recently that has been trying to withdraw from alcohol for some time, actually trying to get over the addiction. She's withdrawn from it some time ago. But the focus of the discussion was related to physical things that could be done to help the brain recover from the years of damage. And so we talked a lot about mainly physical things, but there's some emotional and spiritual strategies that we talked about also, which I'll get into in just a moment. But the physical things that we focused on the most were the nutrients that the brain needs to rebuild itself when it is attempting to rebuild itself, which is all of the time. We used to think that brain injury was relatively permanent, but we now know that there's a lot of what we call plasticity in the brain. And this is because there are actually stem cells scattered throughout the brain that can be activated to help heal or replace damaged brain cells. So what is needed to activate these stem cells um, includes a lot of different nutrient signals. And what is needed to help heal the cells that are already existing, though, that there's always an attempt for the body cells to maintain and fix themselves, are a variety of different fats that we talked about. And so the one that's missing the most in most people's diet are what we call the omega-3 fatty acids. Now, most people, when they think about that, they think of fish. And so fish does have two omega-3 fatty acids that are abbreviated EPA and DHA, but these are what we call derivative um, fatty acids. What is really needed is what is called the essential fatty acid, which is abbreviated ALA. So most people are very deficient in this particular fatty acid. And one of the places that you can easily get it is from flax. So one of the things that I recommend for my patients who want to be healthy or who want to maintain health is to consume a considerable amount of ground flax every day, which has a lot of this particular essential fatty acid. Some people call it a parent fatty acid because the body literally uses it to build other crucial fats. The other essential fatty acid is called the omega-6 fatty acid. Now, there's a lot of misunderstanding about omega-6 because most people consider it a pro-inflammatory fatty acid, although it's a necessary one. And in fact, it is not pro-inflammatory if you get omega-6 that has not been damaged. Unfortunately, most people consume damaged omega-6 fatty acid in the form of the different cooking oils that are widely available in the stores. So while most people get too much omega-6 in their diet, most of what they're getting is damaged omega-6. And so most people are still deficient in non-damaged omega-6. Now, omega-6, the essential fatty acid, is abbreviated simply LA. And one of the best places to get this is in nuts and avocado. So these are simple sources of the omega-6, which is abbreviated LA. And the third fat that we talked about was coconut oil and the subset of coconut oil, which is called the mid-chain fatty acids. So the mid-chain fatty acids are used very effectively by the body, especially the brain, as fuel. And it kind of bypasses some of the steps that the longer fats have to go through to be used as fuel. And so having a lot of mid-chain fatty acids in the diet helps the brain literally to fuel itself. So getting these essential fats into the diet is a crucial part of getting the brain as healthy as possible, which is a crucial part of getting over any kind of an addiction. Because if the brain isn't doing well, it doesn't handle addiction very well. And the aftermath of addiction, of getting better, feeling better, is very much connected to having enough of the right nutrients for the brain to function well. Now, the other areas we talked about are the crucial role of controlling chronic stress. And there are many, many different things that I talk about in helping to control chronic stress. In fact, I have entire courses on how to manage and learn how to control chronic stress that take 3 months to go through. But in a nutshell, the thing that we were talking about today was the use of contemplative prayer as a way to decrease the effect of the stress of getting over an addiction and the stress of the brain not working quite right. So this simple contemplative prayer is called the Jesus prayer, and it's something that I've taught many times in other locations. But the point that I'm making right now is that it's important to integrate health of body, mind, and spiritual resources when you're attempting to come back from an addiction, from recovering from an addiction. If you're not addressing all of these different areas, you're much less likely to make a full recovery and much more likely to bounce back into fully addicted to the substance again, or uh, not 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 able to avoid the use of the substance to which you're addicted. So if you have been dealing with addiction, or you know somebody that has been, might pass on these tips about these essential fats. They're really critical for the brain all of the time, but they're particularly critical for a brain that the cells are attempting to heal themselves from damage. So I wish you well in this. God bless and have a great day.